Thank you, Nadia, and thank you, everyone. It's so lovely to see all of you here in person. Wonderful, wonderful. Thank you so much for coming out early this morning. Beautiful Westfarms Mall. I hope you all got your steps in before you came and sat down. Good, half an hour. I love to hear that. Wonderful. Well, my name, as Nadia mentioned, is Tina Verona. I'm the Media Relations Director at Hartford Healthcare, and I'm so honored to be here with all of you this morning. This is an important time, the month of November. It's annual enrollment period for Medicare. It can be a confusing time for a lot of you, a lot of questions. So we're going to go over everything, and I'm so thrilled and happy to be joined by Marla Pantano. She's the president of CarePartners Connecticut. She's right here in Connecticut. Marla, it's so wonderful to have you with us. I know we have a lot of questions from the audience coming, but first, it's lovely to see you, and the important thing is you are based right here in Connecticut.
Thanks, Amanda. Yes, we are. We are a local health plan. We're the only nonprofit health plan for Medicare Advantage here in the state of Connecticut. And myself personally, I am a lifelong Connecticut resident, and it's been so exciting to be able to help build this health plan really for all of you. And that is what we are here for, is to create a new type of health plan that really listens to our members, listens to the folks that belong, and listens to our doctors. So we are created with our doctors, with Hartford Healthcare, as you can see, so that it really makes sure that we have a really strong collaboration.
You know, and Marla, it's as personalized as you can get, a program like this. CarePartners of Connecticut, if you haven't heard about it, we're definitely going to go over what exactly CarePartners means. Marla touched upon it a little bit. It's an affiliation with Hartford Healthcare. It's a partnership that we've had for a while now, but it's as personalized as you can get with the doctors and everything. So talk a little bit about the partnership itself before we dive into open enrollment.
Sure. So we began in 2018. This time in 2018 was our first open enrollment, but it was a combination of Tufts Health Plan from Massachusetts, which has a very long legacy in Medicare Advantage. As a matter of fact, Tufts Health Plan is only one of 2 health plans in the whole country that has gotten 5 stars by CMS. It's the highest star rating you can get for quality, 7 years in a row. And the only other health plan in the country that can say that is Kaiser Permanente from California, which is a very different model. That's where it's a staff model. You only see the doctors that belong to them. So it really is an amazing company that we merged the strength of Hartford Healthcare and all of that they have grown and continue to evolve to be with Tufts Health Plan to create this health plan that's really, again, designed for all of you.
And I see a lot of people taking notes, which I like to see, because we're going to dive right into it. And do think of your questions and jot them down as we go along, because we're going to come to you in the audience once we're finished with our discussion and make sure that we answer all of your questions that you may have. Well, Marla, this is annual open enrollment. It can be a confusing time, as I mentioned in the beginning, for some of you out there to choose the right plan for you and where you are and your health needs. Explain to the audience what this time period is all about.
Sure. So Medicare is run by CMS, you've heard that of CMS, right? And they set an annual time each year that you can choose to change your health care insurance for Medicare. So it starts in October and runs through October 15th and runs through December 7th. So that's really the time that you can choose to change. You can change your Medicare, if you're already in Medicare Advantage, and we'll talk a little bit more about what that means. You can change to a different health plan or different coverage within your current health plan. If you're just in regular original Medicare right now and you're paying a lot of money out of pocket, it's your time, again, to elect different coverage to help make it a lot more financially advantageous to you. So it's really an important time to really take account for what you need, what your needs are, and what's the best match for you.
So during this time, Marla, and from now until December 7th, when open enrollment ends, what should folks out there be thinking about right now? What should they be doing right now?
Right, so first, you need to do some research, and there are advisors and folks that can help you with that. If you have your own broker or agent, insurance agent, you can ask them for advice and they can help guide you. We have our own resources. We have Eric here today, who you can ask him questions after the discussion if you want to get into more detail on your own personal situation. But it's important for you to look at things like, how much healthcare do you need? Who are your doctors and providers that you see to make sure that those providers are within the network of providers that are covered under each health insurance plan. And what prescription drugs, for example, that you take, because that can also make a difference based on the plan that you choose, and how those are covered and what the co-pays, et cetera, are for those coverages. So those are some of the important things to do, but really to talk to an expert probably is your best help.
And really, Marla, to start now, because December 7th may seem like it's far away, but it's going to come up pretty quickly. So I think the best advice we could give you is to be informed and be educated, and that's why we're here today. Marla, talk a little bit about some of the plan and some of the options that are available.
Sure. So starting at a very high level, right? When you joined Medicare, and some of you probably already are in Medicare, some of you might still be coming close to that time. You first are given the option to, when you sign up for Social Security and you're up 65, then you're going to usually get enrolled in Medicare. You automatically enroll in Medicare Part A, which is all your hospital insurance, and then Medicare Part B, which is mostly your doctor visits, etc., right? And that comes out of your Social Security check. But you can select instead. So if you choose A and B, you have to pay 20% of all of the costs that you incur out of your own pocket. And there isn't any limit to that. So if you get really sick and you have to go to the hospital or you need cancer care or something else, it's very pricey, very expensive. You have to pay all of that 20% out of your own pocket. And you know that for some people that can be extremely, bankrupting. So most people need in addition, Medicare Part A and B do not cover prescription drugs, okay? So most people do, majority of people take some kind of medication, right, on a regular basis. So you would need to select, if you don't choose to join a Medicare Advantage plan, you have to select a Medicare Part D or a prescription drug plan, and you have to pay a premium every month for that. An alternative is Medicare Advantage or Medicare Part C. It's known as both of those. Okay, and these plans cover everything. It's one plan that covers everything. It replaces your regular Medicare and it replaces your Part D or prescription drug. It's all in one package. In addition, many of these plans, like we have plans, that cover other benefits that are outside of that dental. Dental is often something, again, that you'd have to go out and get a separate policy for. If you get one of the Medicare Advantage plans, you can get coverage on dental. Like our plan goes up to $1,500 for the year maximum of dental coverage. In addition to that, there's other supplemental benefits. There's vision benefits, hearing benefits, things that aren't covered traditionally under Medicare. There's silver sneakers. Many of you are walkers here, so you might enjoy the silver sneakers benefit that allows you to get fitness benefits. There's other wellness dollars. There's over-the-counter dollars that are given to you, so you can get some over-the-counter medications each quarter. So there's a lot of additional benefits that you get when you join a Medicare Advantage.
And that's what I was saying earlier, how it's really a customized plan. So wherever you're at, in whatever stage you're at, if you're taking medication, I saw somebody in the audience nodding that they don't take medication, which is great. But wherever you are at specifically in your life, you can tailor as much coverage as you need. And you were talking about dental and vision, so you can always add on, which I think is great. And speaking of adding on to coverage, how does that save you money?
Well, so these Medicare Advantage plans that I'm speaking of, our most popular plan is a zero premium plan. And that means that you pay the Part B premium through your Social Security as you do, but in addition to that, you pay nothing else. You sign up, and there is no extra cost to you. And you get all the benefits I just described. Now, there are some co-pays, but we have $0 co-pays for your primary care physician, $0 co-pays for generic medications that are done in our preferred pharmacies. So there are a lot you can do, and it's very little cost, versus if you went out and got a Medicare supplement plan, which many of you may have heard of, which does not cover prescription drugs. You'd have to go get prescription drugs separately. It does cover some of the cost share that I was talking about before, that 20%. But they're very costly. They're usually a few $100s a month versus a Medicare Advantage plan that you can get for free, or if you want something that has maybe less cost share on certain things that you pay a small premium.
And let's dive into a little more of the specifics of the Medicare Advantage plan and how it would help them save if they were to choose that.
Sure. So again, if you're, say you're going to the doctor once every few months and you're getting certain medications, you have high blood pressure medication or lower your cholesterol medication, things that are very common. Many people take them, right? And those are very common medications that have generics, so they're $0 copay. So you're paying nothing out of your pocket. You're getting all of these benefits, and it's no cost share to you. And then if you're going to see your PCP, there's no cost share. If you go see a specialist, there is a copay for that, but it's much less than paying that 20% that you would pay under Medicare. So the real difference. Why can we do this? Somebody laughed. Well, how nobody would think. So how does that work? So I just want to kind of dispel some of the myths about that. The reason is because we also have folks that care managers. So say someone does get ill and they really need extra care. We have folks both at Hartford Hospital employees that help with this, as well as at CarePartners, that help coordinate people's care, help them get to the right care, help them stay out of the hospital. Nobody wants to go into the hospital, right? To really help you navigate your health, keep your health the best it possibly can be, give you the resources so that you avoid going to the emergency room, going to the hospital. So by doing that, right, we're keeping those costs are very high, can be very high, keeping those down, we're able to pass that benefit back to all of you in these rich benefits.
Health and wellness is so important, and I know that's something that all of you in the audience take very seriously. Avid walkers in the mall every day I see all the sneakers on, so I love to see that. Health and wellness, without that, we don't have anything. Marla, we hear a lot of terms this time of year, Medicare supplement plans, Medicare Advantage plans. As I said, it can be so confusing. What's the difference between the two?
Yeah, so Medicare supplement plans, there are specific plans that the government has designed that, very specifically how they cover the different cost shares that you normally have under traditional Medicare. And they do allow, the other difference, they do allow you to see any doctor or anyone you want to see. But they are costly, right? So they are, like I mentioned, normally, it depends, but normally in that couple $100 a month range, depending on the plan that you choose. A Medicare Advantage plan, as I was just describing, really allows you all of these other benefits that go well beyond a Medicare supplement plan, the prescription drug, the dental, all of the other benefits I mentioned, with limited cost shares for sometimes no premium at all. But you do need to stay, you do need to see doctors, you need to have that coordinated care, which, with the doctors that are within the network. You can choose, there are differences. There's an HMO plan, which is our most popular plan, where you do get the richest benefits, but you do stay within those sets of doctors and hospitals, unless you can get a referral by a primary care physician to see a doctor outside the network. But we also have a PPO plan, and many others have PPO plans, that you get the best benefits if you stay within the network, but you do actually have benefits if you decide to go out of the network as well. It's covered under the out-of-network benefit, usually with a deductible, et cetera, you have to meet first.
So if a Medicare Advantage plan is right for some folks out here to choose, is that costly for them to add into their plan?
No. Again, it's really, these are the opportunities. There's many opportunities that are zero premium. There's some that are small premiums. If you want less, cost share at the time you go see the doctor or time you go into the hospital. If you want to reduce, what some of those charges are, you can pay a small premium for an upgrade.
Got it. Is there an easy way to compare Medicare Advantage plans to other plans? How would they go about doing that?
Well, one resource that you can access if you're, feel comfortable going on the web, on the internet, is you can go to Medicare.gov, That's CMS puts that together, and it lists all the different health plans that are available to you in the market. They rank them, and you can just go on there based on what they believe is the best value to you. We're really proud to say that for CarePartners this year, we got the #1 ranking this year for Connecticut. And that's based on both the quality, and maybe we'll talk a little bit about that, about the star rating, as well as the plan design. And for us, a big piece of that is we put in a very low maximum out of pocket. What that means is the maximum amount if you were to get sick and had to use a lot of benefits, what's the maximum amount that you have to pay out of your own pocket before everything is covered at 100%. And so CarePartners is right now by far the lowest in the market on that. At $4,900. Most of our competitors are a few $1,000s higher than that. So, you can use Medicare.gov and go shopping and compare. And then once you see what's available on there, if you're interested in certain plans, you can go onto their websites and look there. Or there's phone numbers that we can give you to call, and you can talk to agents, et cetera, that can explain what the options are. You can also go to an independent broker or agent, as I mentioned before. There are folks there that can sell most plans in the market and help educate you as well.
I do, that was a nice segue. I do want to talk about the star ratings. You mentioned in the beginning, CarePartners of Connecticut received a 5-star rating, ranking right up there with Kaiser Permanente, which is pretty impressive. But what does that mean to the folks sitting here and watching us on Facebook?
Yeah, I do want to clarify that it was Tufts Health Plan, which is
Tufts Health Plan, yes.
We got our first star rating, and it's very hard when you're a brand new plan, right? And people don't know you. And I'm going to explain how star ratings work, but we got a 4.5 star the very first time. And only 13% of plans in their first 5 years of getting star rating hit 4.5 stars. So the very first year, we got 4.5 stars, and we really believe it's due to this strong collaboration that we have between Hartford Healthcare and us, and that we're able to give quality care. What a star rating is, just so you know, it's based on really objective information and data, and it's 50 different measures. So it's not like just one, it's not like you go on Google and how do people like it. It's based on the quality of care that's being provided. So there's very clear measures that the government has come up with of what they believe the quality of care measures. It's based on your experience, and it's based on the actual experience of folks that are using our health plan. They survey them, and they ask them a variety of questions about whether they're getting the care they need. Some of it is related to your doctor. Can you get appointments quickly? Do you feel like you're seen quickly? Do you feel like you're getting good care from your doctor, et cetera? Some of them are around the health plan. Do you believe when you call the health plan? Are you getting good customer service? Are they treating you with respect? All of those kinds of things. And I am proud to say that CarePartners on that customer service got a 5-star rating. So there's individual measures have individual rankings. So meaning that our members really feel like they're being treated well, and that when they do have to call us, they're getting clear answers and they're being treated with respect, which is really important to all of us. And on many of the measures on the Hartford Healthcare side too, with doctors there, 5 stars. So it's really, we're really proud of that 4.5-star rating.
And I think in terms of Hartford Healthcare and the Hartford Healthcare side of it, we are in the communities where you all live. So, and I think that's important. There are family health centers, there's urgent cares, and they're all in the communities where each and every one of you lives. So it's not the days of I have to go to the hospital to see my doctor. We're in the communities, and I think that really is strong, and that really does help.
Oh, definitely. It's been a great collaboration. I do want to clarify just if it's, although this is a joint venture and Hartford Healthcare is the core of it, we do have many other providers besides Hartford Healthcare providers. So if you do have doctors that are not Hartford Healthcare, certainly I don't want you to think that you can only join if you have Hartford Healthcare physicians. So, but it certainly this collaboration has really improved, what we do, our policies, how we work, how we try to reduce as much of the friction, as much of the hassle factor that many health plans are doing.
And I think to also further clarify is the fact that CarePartners is right here in Connecticut. So you're not calling someplace that's not local. So I think we talked about that in the beginning. How can people find more information about choosing a plan that's right for them? I know we have Eric here who is going to be answering your questions. He has brochures to give to you after. But right now, and you mentioned going online, there is a phone number where you can also call that we're going to make sure that you guys all have before we leave today. But where do they go to find the information, and how do they go about that?
Yeah, so they can go to Medicare.gov, I mentioned earlier. You can go to an independent broker or agent, and you can search for those online if you want, as far as if you don't know resources. And we can actually, if you feel more comfortable talking independent, we can refer you to someone that can do that. Or you can call our 1-800 number, and we have very qualified licensed broker and agents that answer that phone and can answer all kinds of questions for you. We also do Medicare 101s that go into more depth than what I'm doing here, that Eric and one of his colleagues actually run. So you go on to our CarePartnersCT.com. They're all listed there. We give a lot of variety of dates and times. So you go on there and listen to that and see if that gives you additional information. So there's a lot of different resources that are really available to learn more.
And I do want to make sure that we pass that phone number along where you can reach Care Partners directly. I see some of you taking notes, but you definitely want to write this number down. It's 1-844-345-0967. Again, that's Care Partners of Connecticut, 1-844-345-0967. We'll also have that number for you after as well. Or you can go to carepartnersct.com/connect, as Marla mentioned, to sign up. Marla, this has been so informative in terms of some of the terminology that we hear this time of year, and so helpful. As we talked about what folks should be doing now, but as we get closer to December 7th, when should they really have their minds made up in terms of what plan they're going to go to, and what questions should they be asking themselves? I know we touched upon that in the beginning in terms of medications that they're on, but sort of chart out that path to get to December 7th so that they're not all scrambling on December 7th. Oh my gosh, I have to sign up and I haven't done so. So sort of take us through that process leading up to December 7th when they actually sign up for their insurance.
So just, you can sign up today, so
Yeah.
you don't have to wait till December 7th. So I want to make sure that's clear. December 7th is your very last day, so it'd be better for you to do it sooner rather than later. Particularly if you want to find another resource to assist you, you want to start seeking those out now. I would go into that and, again, with your list of medications, with your list of doctors, so that you have a good idea of going in, and even if you want to do your own research, you can go online. There's provider directories of all the different payers online, so you can look up to see if your doctors are in the directory. But yeah, I would start with those lists, and then I would honestly call somebody to really help you if you're not comfortable yourself, rather than trying to do this all on your own. So call the 1-800 number we provided, or talk to another licensed broker or agent. But I would definitely start that sooner rather than later, so as soon as you can. When we ask people who are their resources to decide what insurance, most people answer one of two insurance. One is your broker agent, if you have one. That's a popular one. The other is their family and friends. So it is okay to ask folks that what's their experience, and do they like their health plan, what do they do or don't like about that. Don't discourage that. But you may want to also look beyond that. Especially with us as a new plan, we don't have a lot of members yet, so there's not going to be a lot of your folks out in the community that are necessarily results, but that doesn't mean that we don't have a lot of value, because we do. And so we're trying to get that message out. So I would suggest talking to some of those experts would be a great idea.
Informed and educated are two great things that you want to be before signing up, and I think that this open enrollment period allows you to do that. Before we go further, Marla, I know we have some questions from the audience that I do want to make sure that I see this gentleman's hand going up right here, so I'm going to go to you first. Make my way over to you. Sir, good morning. What's your name? Mari, what's your question for Marla?
The dental program, you have to stay with your, network doctor, dentist, or I can just stay with my own dentist. And if I'm out of town, out of country, what is the coverage?
Good question, Marla.
Yes. So let me first start with, you asked about the dentist. So actually one of our enhancements this year, because we did hear from folks like you that really wanted to keep their own dentist, in our original plan, it was, you need to use one of the network dentists. But this year we actually offer the exact same coverage for out-of-network. So on dental, even on our HMO plans as well as our PPO plans, you can see whatever dentist you would like, and you get that $1,500 covered. Now, on physicians, you would choose an in-network physician for your primary care, and then mostly your specialists. But if you had a specialist, say that for some reason wasn't in our network, that you had an established relationship, your primary care physician can give you a referral to them, and it would still be covered in network. For going out of the country, we do have, emergency coverage, et cetera, for you if you have an emergency when you're out of country, or, traveling even within the U.S. There is, that is covered under kind of urgent care or emergency. If you're traveling and you're like spending half of your year in one place and half the other, there may be other plans that are a better fit based on that. But for those, if it's just, travel, like where you just need some urgent care, that is definitely covered.
Does that answer your question?
Thank you.
Okay, thank you. I think I saw your hand go up second here. I want to make sure I get to you. What's your name and your
My name
question?
is Claudette Pittman. I have a question. I was in Georgia recently. Now, if I go to Georgia, I'm a diabetic, and I have to go to the emergency room down there. I don't have any doctors down there. What would I do? Would they cover the emergency room while I'm there?
Yes.
And they would assign me to a doctor, because I wouldn't know what doctor to pick, because my doctors are here. So would that be covered? I don't know.
Good question.
Is time.
Yeah, my son lives down there, so I do go down there to see his family.
Mm-hmm. Yes, I mean, if you're getting your regular care, you would want most of your regular care here in Connecticut. But if you needed some urgent care down there, yes, that would be covered.
Any other questions? What's your name and your question?
Janice.
Hi, Janice.
My question is, like with Medicare, Part D, because I pay Part D, but I have Medicare Advantage plan.
Most Medicare Advantage plans cover prescription drugs. There are some that don't, but Eric, I don't know if you know this answer. I want to make sure that I'm answering this correctly. We may have to look at your situation specifically, just to make sure that we're answering. So maybe if you could talk to Eric after. I don't want to misguide you.
Right.
But most Medicare Advantage plans, the prescription drug is part of the plan. You don't need a separate Part D plan.
Okay, so you stick by after, we'll get that, we'll have you talk to Eric.
And why that might be.
Okay, we're gonna come right over here. And what's your first name and your question?
Carol.
Hi,
I have
Carol.
2 quick questions.
Sure.
If you have to go to the hospital, do you have to go to Hartford Hospital?
No. Yeah. I can list all the hospitals we have, but yes, it's not just our hospital.
Does your plan cover like teledoc, or do you have a
We do have
program?
telemedicine coverage, yes.
Great, thank you. Any other questions from our audience? I know you guys aren't shy. There's got to be more questions than this, right? You have another question?
What is telemedicine cover?
Oh, what is telemedicine coverage?
So
There we go.
if you certainly during the pandemic, many of you may have seen your doctor virtually, like on the computer or whatever. Yeah, that's covered as well, yes.
Good, absolutely. Ask away.
So if I go to a urologist, I consider that a specialist. As long as I would go through my primary care doctor, it would be covered.
Yes, specialists actually, so if you're using doctors that are inside of our network, you don't even need a referral from your primary care physician. You can go see your doctor, you can make the appointments yourself and see your doctor. We do recommend if you have a new need for a new specialist, like if you say you get a new condition, that you do refer to your primary care and have them help guide you to their appropriate care. But as long as that doctor is in network. Now, if that doctor for some reason isn't participating with our plan, then you can go to your primary care doctor and ask them to refer you.
Now the RX copays, you said RX copays. It depends on what you get, but if you get generic, it's no copay.
We have plans that for generics, tier 1, tier 2 drugs that, assuming you get it from like CVS or pharmacy is one of our main pharmacies, but we have other pharmacies as well that are participate, it's a $0 copay to you.
Because I have Federal Blue Cross supplement, and one of my prescriptions is 10, but the rest of them are either 0 or $3. So I think that other one, they don't have like a generic for it, and I pay $10. So I don't know how much it would be for something else.
Yeah, certainly if you'd like to know more about our plans, stop by and Eric can help explain what the other copays are for some of the brand drugs. It varies depending on.
Good questions. Any other questions from the audience? Did you
We also do have $0 vaccines, so if you need like a sugar vaccine and all that, those are
Another-
okay as well.
One other question.
I had a knee replacement last year, but a year ago today. Now, I came home the next day, which was fine. But in the previous time, they recommend I go to a rehab. Now, is there certain ones that we have to go through under CarePartners, or can you pick the one you're going to go to? Because the first time I had when I went to Doncaster, this time they tell you to go home, which was fine. It worked out real good. But I'm just saying, just in case people say, since I am a diabetic and I am of an age, well, you need to go to a rehab before you go home. Is there certain ones I can go to, or?
We do have a preferred network of skilled nursing facilities. Again, we choose those based on quality metrics and others to make sure that you're going to get the best care. So we would work with you to make sure that we found a facility that really worked for you, that was close to your family and other things that you could be comfortable. But just so you know, on that, on the knee replacements and everything, obviously technology has improved things greatly, and so it is best for everyone if you could avoid going to a rehab or skilled nursing, because as we saw in the pandemic, it is unfortunately a community where a lot of disease and things are
The first
spread.
time, it's a big difference. They do it, what they call it, I forgot now. But anyway, the first one.
Minimally invasively,
Yeah,
probably?
The first one, they sent me themselves because I had to go home. But this time, I went on Monday, I came home on Tuesday. I forgot they knew what we were doing it now. So there was no reason to go. You know what I'm just saying? But just in case I had some kind of problem, since I do have diabetes, they would have sent me somewhere. And I would say if I was living
We have
alone.
many skilled nursing facilities. I'm sure it would be one that would be convenient.
And any other questions? Did you have your hand up? No, you're good? Okay. You may have some questions that you maybe not feel comfortable asking in this forum, but of course Eric is here, and Marla will be here after to answer all of your questions. We hope that you found this valuable and that we answered the questions that you did have, and you feel a little more educated and informed, because that's the point during what can be such a confusing time. So thank you all for being here in person and for watching on Facebook, and to Marla for being here as well. We appreciate it.
And thank you as well.
You're welcome.